Women who breastfeed are less likely to develop infections, including urinary tract infections, reproductive infections, and even certain respiratory conditions. This immune boost contributes to a mother's resilience against illnesses. Breastfeeding also acts as a safeguard against bone diseases. While calcium is used during breastfeeding, the body quickly adapts by increasing bone density once weaning begins. This means mothers have stronger bones in the long run, with reduced risks of osteoporosis, arthritis, and fractures in old age. The bone-strengthening effects are especially important for women entering menopause, a stage when bone density usually decreases. The emotional health benefits cannot be overstated. Breastfeeding reduces the risk of postpartum depression, a condition that affects many new mothers worldwide. The release of oxytocin during breastfeeding not only calms the mother, but also enhances bonding with the baby. This emotional connection provides a sense of security, lowers anxiety, and reduces feelings of isolation or sadness. In addition to improving mood, breastfeeding helps with stress management. Mothers who breastfeed report lower stress levels compared to those who do not. This is because breastfeeding encourages relaxation and lowers blood pressure. But this not only supports physical recovery, but also lowers the risk of certain complications after birth. Breastfeeding is also cost-productive and convenient, which indirectly supports maternal health. Since it is always available, sterile, and nutritionally complete, mothers avoid the stress and financial burden of formula feeding. This ease reduces anxiety, helps mothers focus on recovery, and creates a healthier environment for both mom and baby. Altogether, breastfeeding is not just a gift for the baby, but also a natural medicine for mothers. From lowering cancer risks to protecting against heart disease, supporting bone health, improving mental well-being, and helping with recovery, its benefits are far-reaching. Choosing to breastfeed gives mothers a lifetime of health advantages, making it one of the most important decisions for both their own future and their child.
Like, seriously, it's made just for them and changes as the baby grows. How cool is that? Also, I didn't realize how breastfeeding helps build this super strong bond between the mom and the baby. When they're close like that, it makes the baby feel safe and loved, and it's great for their emotional development. Plus, it helps the mom too. It can lower her stress and even help prevent postpartum depression. I love how something so natural can be so comforting for both the baby and the mom. And get this, there are health benefits for the mom as well.
If a mother has a genetic predisposition to diabetes, heart disease, or cancer, breastfeeding can significantly lower her risk. It acts as a natural defense mechanism, giving women more control over their long-term health. The emotional connection between mother and child is also a health benefit in itself. Breastfeeding creates a deep bond that improves emotional well-being for both. This bond helps reduce maternal stress levels and creates a sense of fulfillment that supports overall mental stability. It also has long-term effects on a child's emotional and psychological development. Breastfeeding is also beneficial for metabolism. By helping regulate blood sugar levels and improving insulin sensitivity, it lowers the risk of type 2 diabetes. This is especially important for women who experience gestational diabetes during pregnancy, as breastfeeding helps reduce their chances of developing permanent diabetes. For women recovering from childbirth, breastfeeding plays a role in faster healing. It encourages the uterus to contract, reducing postpartum bleeding and helping the body return to its pre-pregnancy state more quickly. This not only supports physical recovery, but also lowers the risk of certain complications after birth. However, it's not clear how far physical recovery is equivalent to mental recovery, since some colonists are more likely to report seeing loss of birth weight. But this not only supports physical recovery, but also lowers the risk of certain complications after birth. Breastfeeding is also cost-productive and convenient, which indirectly supports maternal health. Since it is always available, sterile, and nutritionally complete, mothers avoid the stress and financial burden of formula feeding. Breastfeeding continues to be one of the most profound ways a mother can invest in her own health while giving her baby the best possible start in life. Each time a mother breastfeeds, she is not only passing vital nutrients and antibodies to her baby, but also triggering processes in her own body that protect her from serious illnesses. These benefits are often overlooked, yet they remain essential for both short-term recovery and lifelong health. One major way breastfeeding benefits mothers is by stabilizing hormones after childbirth. During pregnancy, hormone levels fluctuate dramatically, and this can sometimes lead to imbalances that increase the risk of certain diseases. Breastfeeding naturally regulates these hormones, lowering the chances of developing reproductive cancers such as breast, ovarian, and uterine cancer. By balancing estrogen and progesterone, it also prevents hormonal swings that might otherwise cause long-term health problems. Breastfeeding also reduces inflammation in the body. Inflammation is one of the key contributors to chronic illnesses such as heart disease, diabetes, arthritis, and even cancer. The process of breastfeeding lowers stress hormones like cortisol, while increasing hormones such as oxytocin, which reduce inflammation and promote healing. This natural balance keeps mothers healthier, both physically and emotionally. While increasing hormones such as oxytocin, which reduce inflammation and promote healing. This natural balance keeps mothers healthier, both physically and emotionally. Another powerful benefit is the way breastfeeding strengthens the heart and circulatory system. Women who breastfeed have a significantly lower risk of hypertension, heart attack, and stroke later in life. This is because breastfeeding improves blood vessel function, promotes better circulation, and helps maintain a healthy weight. Together, these factors create long-term cardiovascular protection. Breastfeeding also has a direct impact on digestive and liver health. Studies have shown that women who breastfeed are less likely to develop gallstones, fatty liver disease, and other digestive problems. By encouraging better metabolism and fat utilization, breastfeeding helps the liver function more effectively while protecting against dangerous conditions such as cirrhosis and gallbladder disease. Another remarkable aspect is its impact on the immune system. While many know that babies receive antibodies through breast milk, fewer realize that breastfeeding also strengthens the mother's immune defenses. Women who breastfeed are less likely to develop infections, including urinary tract infections, reproductive infections, and even certain respiratory conditions. This immune boost contributes to a mother's resilience against illnesses. Mental health is another area where breastfeeding provides crucial support. New mothers often struggle with postpartum depression, anxiety, stress, and emotional exhaustion. Breastfeeding helps reduce these risks by stimulating hormones like oxytocin, which promote relaxation and emotional bonding between mother and baby. This creates a positive cycle that benefits both mental and physical health. In addition to reducing stress and depression, breastfeeding can improve sleep quality for mothers. Even though babies wake often, breastfeeding hormones help mothers relax more quickly and return to sleep faster. This improves overall rest, which is essential for recovery after childbirth and for maintaining long-term mental health. Breastfeeding also strengthens the immune system of mothers. While it is widely known that breast milk protects babies from infections, mothers benefit as well. Women who breastfeed have a lower risk of infections such as urinary tract infections, mastitis, and other inflammatory conditions. By supporting the immune system, breastfeeding helps mothers stay healthier and stronger. Another advantage is that breastfeeding helps regulate the menstrual cycle and delays the return of periods after childbirth. This natural spacing between pregnancies not only helps mothers recover, but also reduces exposure to hormones linked to reproductive cancers. It is a natural and healthy benefit that supports overall reproductive health. For women with a family history of chronic illnesses, breastfeeding provides additional protection. If a mother has a genetic predisposition to diabetes, heart disease, or cancer, breastfeeding can significantly lower her risk. Mothers experience a long-lasting protective effect. In addition to its cancer-preventing properties, breastfeeding plays a vital role in supporting health. Mothers who breastfeed are less likely to develop high blood pressure, heart disease, diabetes, and high cholesterol. This is partly due to the way breastfeeding is hydrated and restores the body's natural balance after pregnancy. These benefits make breastfeeding a natural shield against some of the world's most common and dangerous diseases. While most people know about the nutritional value of breast milk for infants, fewer realize the significant health advantages it brings to mothers. Beyond being a source of nourishment for the child, breastfeeding acts as a natural safeguard for women, lowering the risks of many life-threatening illnesses and supporting long-term health. Exit damage is not just about someone's health or well-being. One of the most remarkable benefits of breastfeeding for mothers is its role in reducing the risk of various cancers. Studies have shown that breastfeeding lowers the chances of developing breast cancer, ovarian cancer, uterine cancer, and cervical cancer. This happens because breastfeeding helps regulate hormone levels, particularly estrogen, which is linked to cancer cell growth. By reducing exposure to these hormones, mothers experience a long-lasting protective effect. In addition to its cancer-preventing properties, breastfeeding plays a vital role in supporting heart health. Mothers who breastfeed are less likely to develop high blood pressure, heart disease, diabetes, and high cholesterol. This is partly due to the way breastfeeding burns calories and restores the body's natural balance after pregnancy. These benefits make breastfeeding a natural shield against some of the world's most common and dangerous diseases. Weight management is another area where breastfeeding helps mothers significantly. Many women find it difficult to lose pregnancy weight, but breastfeeding naturally burns extra calories, helping mothers return to their pre-pregnancy weight more easily. Breastfeeding is one of the most natural acts of human care, yet it remains one of the least understood and appreciated in its full depth. Often seen as just a method of feeding a baby, breastfeeding is far more than a nutritional process. It is a powerful biological, emotional, and social experience that offers a wide range of benefits to both the infant and the mother. From the first drops of colostrum to the last moments of weaning, breastfeeding provides unmatched support for growth, development, and bonding. The early milk produced by a mother's body after birth is called colostrum. This thick, yellowish fluid is rich in antibodies and acts as the baby's first immunization. It provides protection against infections and prepares the baby's digestive system to handle life outside the womb. Colostrum contains high concentrations of immunoglobulin A, IgA, white blood cells, and growth factors, giving the baby a strong immune foundation during the most vulnerable days of life. Breast milk is a dynamic, living substance that changes in composition over time to meet the baby's unique and changing needs. It provides the exact amount of proteins, fats, carbohydrates, vitamins, and minerals required at every stage of infancy. Unlike formula, which is static and manufactured, breast milk is tailored to support a child's development.